child protection is it's a sector that easily falls off the plate when put together with other sectors. So this guide is what will help you understand and detect what the child protection issues are in any forum and be able to advocate.
In terms of helping the child protection subsector mobilize resources and justify resources required for child protection services, I think the child protection minimum standards have played a very key role because they elaborate what is required in order to provide a responsive service to a child who is in need.
I have used them a lot in Haiti and also in Venezuela, because it's also a way of letting the donor know that we are aware of what they are looking for, that we are committed to delivering the best possible results for children in the best way, in the most efficient way, and in the most inclusive way of involving local counterparts, involving authorities, involving communities, affected communities, and having everyone on board. Because I believe that CPMS should be included in any proposal related to child protection.
Before allocation papers are developed and shared to eligible partners, the country-based pool fund managers engage in extensive consultations with the sectors, and each of the sectors have their standard indicators, their standard strategic objectives, and all that, which were designed in adherence to the child protection minimum standard. So partners cannot just request for funds or mobilize funds from the country-based pool fund if the program you seek to address is not in line with the strategic objective of the sector, and if it cannot be measured with the standard indicators that the sector has provided. So without the child protection without the child protection minimum standards, I don't think those indicators will be developed, and those strategic objectives will be developed. And if the strategic objectives are not developed and the indicators also are not developed and shared with the country-based pool fund managers, then there will be no funding for CP actors there.
When we advocated for the Republic Act on child protection in emergencies, one of the provisions that we included is a budget appropriation. So that would mean that all local government units has this dedicated fund for disaster risk reduction. But right now, most of the local government units are unaware of how they are going to go about in using the funds. So because we have the child protection minimum standards, and the Republic Act was based on the CPMS, what we did is to prepare the menu so that local government units are able to select specific activities and then allocate specific budget from the local government. So that would mean that resource mobilization should be done at the local government level, and that there are existing resources that they can use and tap into. So it's like a menu that they can select from. And we have distributed that to all the regional coordinators so that whenever local governments would request for technical support in developing the annual investment plans at the local government level, they can just extract specific activities from that guide and then integrate it in the annual investment plan of their local government. So it forms part of their preparedness as a local government.
And child protection is a human resource intensive response. It's a human resource intensive profession. That requires that we invest funding in hiring people, in training them, in mentoring them, in supporting them. And I think the fact that we have the CP minimum standard has helped us to bolster that information and to show partners, to show donors, to show the government what is required to provide responsive child protection services. I'll give the example of case management. Child protection case management is a human resource intensive service and requires a lot of investments in terms of funding, not only of hiring the staff, but also of the tools that are used to manage cases, the travel required, the support services needed for children, and therefore that brings the cost of child protection case management quite high. So what the CP minimum standards helped us to do is to come up with a guidance on the minimum costs.
So looking at minimum standard, it clearly says like, one caseworker for 25 children, but that's not the reality in common setting in many contexts. I used to do an analysis based on the minimum standard, the ratio for child versus the caseworkers versus the child, and then that put to put that into a reality and to outline to various locations where how many caseworkers we have and how many children that we are dealing with. And it's really tell us like, certain locations are kind of okay, it's manageable, and certain location is very alarming. It's really red signal. It came out, when you put those analysis into a mapping. So when we kind of have a meeting with donors and we say, okay, this is a situation we are in, and so we can't able to really provide a quality case management support if you don't really get adequate resources. So that really evidence, really helping us donors also to open up and to see, yes, that's the reality to support. So I use that as a kind of tool to really, convince the donors and to get some additional resources for child protection.
So this is how we've used it. We've used it as a reference to show what gaps there are in providing child protection services for children, and then associating these gaps with a cost, and then developing an appeal for the sector.